And we're live.
Are we?
Yeah. Dr. Mark Vaughn.
Like every time. It's
Dr. Dwayne Vaughn.
Oh, and
Like
you may
it's
have
a
noticed somebody
surprise.
else is here. Yeah, you may have noticed that every time it's like this if you watch our videos. Oh, yeah, we're on.
And this is Vanessa Walker.
Hello.
Dr. Vanessa Walker, a pulmonologist.
Yes.
So she knows lungs.
Yes, and a critical care doctor,
And
so
critical-
I
yes.
know,
You know a lot
ICU.
more than just lungs.
We will get into that. And today, when we get on our actual topic, which we do usually get to it during our videos,
Eventually.
Usually.
we'll be talking about death and dying. And we won't be as inappropriate during the actual topic as we are right now.
Correct.
Yeah.
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 We've been
We can be
criticized.
serious
Yeah.
sometimes.
We
Sometimes
can.
people
Gwen and I have been called...
don't like our joking.
Yeah, we've been called second graders.
What?
and-
Second graders. Usually junior high. That's usually what I'm accused of. Yeah.
Yes, and those people who make those comments, we told them, perhaps you would prefer to see the LifeOn10 channel.
That's right.
They're more mature.
They're more.
I don't know about that. We are mature, but we do like to have fun.
Okay. Well, yeah, let's introduce your channel.
Yes, let's talk
Yeah.
about that. What do
Yes.
you do on YouTube?
So I have started a new YouTube channel. It's called LifeOn10. My colleague Angela Trapp is a life coach and a social worker.
And just all around great person.
Amazing person,
We
you
all
know,
know her, yeah.
firsthand. So we are working on trying to engage with pretty much everybody, not just about medical topics, about anything that's important in regards to living your best life. That's really what we're focusing on. So we did our first episode was more introducing, and then the second episode we're going to have coming up is going to be focusing on parenting styles versus stay at home versus parents that have to go to work. And so why does it have to be a versus? Why can't it just be, these are the decisions I made?
That was the first comment. That somebody
like
made
it.
on the,
Yes,
on the
exactly.
video.
So
Yeah.
we took them up on it, and that's what our first video is going to be on.
Wow.
Yeah.
So
I'm definitely going to watch that one.
a YouTube channel where the... Boy, that's interesting, isn't it? a YouTube channel. There we go. Where the hosts actually respond to the comments.
Yes,
You know.
yes, that's we are working
cool.
on that.
Yeah.
Absolutely.
All right. So we are very excited to have that happen. And we're looking forward to your next video with, we haven't talked about Angela.
Yes.
Yeah.
Yeah.
So
So
you did. You said that she was a
I
life coach.
mentioned Angela is an amazing, first of all, an amazing person who has helped me on the front of trying to make sure that I don't burn out as a physician, which is huge.
Yeah, absolutely.
I've had all kinds of help from her in that arena, and she helps lots of other physicians as well. So that's how we got together, and she just really, she can get into any situation and get to the bottom of it and have you question, you know that person that you can talk with that just knows how
Like
to
a
get to the right
counselor,
thing?
yeah.
Exactly. She's amazing. So,
So how does that make you feel? No, just kidding.
right? Yes, but in a cool way.
Yeah,
in a
yeah,
way
yeah,
that
she's
doesn't.
really good.
Yeah.
Yes, we appreciate her.
She does a lot of good work for us.
She does. She does.
So that's your YouTube channel,
Yep.
LifeOn10.
LifeOn10.
After this is done, make sure there's a link in
There's
the
a link
description
already.
below.
Yes.
Yeah,
Right
go
now.
over there,
Check us
hit
out.
subscribe, check the bell
Please.
icon so you get that. It's going to be
Yes.
released once a month.
We're so far we're doing once a month on
Okay.
the 10th of every month. But once you all like us, we're going to probably do more.
Hey, there you go.
So do. Make sure you
So
subscribe.
that's your YouTube life. Tell us about
Yes.
your medicine life. Tell us, what is
So-
critical care? What do you do?
So critical care, I focus on the patients who are the sickest of the sick. So
Yeah.
people that come into the intensive care unit and need life-saving measures. So whether it's for your lungs, or you're having a heart attack, or you've got a really bad pneumonia, or influenza, if you got the coronavirus, and you were one of the unfortunate people to not do
wearing
well,
masks.
you would potentially come in and see me. So as much as I seem really bubbly and fun and goofy now, I assure you, when I am taking care of you in those situations, I am very serious and on the ball, and will make sure
Yes.
I take the most proper care of you.
Yeah, I like to say that about myself too.
Yeah.
I just joke around all day.
Oh my goodness.
Yeah. Cool.
So, death and dying.
Yeah.
How did that come about?
So, well, as you can imagine, unfortunately, I do see my fair share of death and dying. And the thing that struck me the most in everything that we've been dealing with is the people that end up dying in the intensive care unit in the hospital that really should not have ever even been admitted.
Oh, sure.
They should have, when they started getting worse, their families should have come together, hunkered down and let them pass away at home in a more peaceful and just kind manner. Because I hate to say that once you come into the intensive care unit, and if it's your time, things are not comfortable.
Yeah.
They're not comfortable.
Lots of interventions.
Absolutely. I mean, so many interventions, people in and out. It's not quiet for your family. There's a very little room in there. It's just in Americans, they've done studies and they've asked Americans, how do you want to die? And 80% of Americans say, I want to die at home with my family. But unfortunately, only about 20% of people are actually dying at home with their family. Wow. So there's a huge disconnect on what people want and what actually happens. Yeah. And that's where I really felt like, this would be the perfect audience, especially because you two are primary care doctors and you're able to reach so many people before they end up in my ICU.
Yes.
Yeah.
And there was that article that you shared with me out of Huffington.
I think it was Huffington Post, and there are so many articles that are looking into this because I think, and this is what I like to start all my death and dying talks. I do a lot of this talk. I'm a medical director at a respiratory therapy school. I do this for the respiratory therapy students probably every month, and I say, we're Americans. We're like, this is America, right? We do everything hardcore. We don't give up. We want it all, and unfortunately, that has, I think, bled over into healthcare and the dying process, right? Yeah. And so because we are so never give up, never surrender, unfortunately, that's not true, right? We all know that there's only two things in this world, death and taxes, right? It's coming. Yeah. And so we can't avoid death. And I think we, in the healthcare setting, have constantly been trying to do that. Right. Just fight it.
Like we treat the human body like a car.
Exactly.
That you can always do something more to keep it going. There's always something else. You can get another engine, or you can rebuild it.
Exactly.
But with humans, you can't. There does reach a point where you can't. There is a true point of futility.
Yeah. And when it's not even a matter of can't, but it's a you don't want to. I've had so many patients. I mean, my aunt, who was very elderly, and I remember she lived at an assisted living facility, and people would come live, and then they would pass away. And she looked at me one day and she said, "I just keep wondering when it's my turn." Mm-hmm. And it's because it gets to a point where living in that body is not fun anymore. You've hit that point, and I think. If you're not living in that body, you don't understand that. And so a lot of times we get, our 90-year-old grandmother in there who everyone says, oh, she was doing great. There's nothing, let's just, I think we could just tune her up and get her better. But the problem is, if you're not living in 90-year-old grandma's body, you don't know what it's like to be her. And making decisions for her from your perspective, especially the younger you are. I've had to have death and dying talks with, teenagers and 20-year-olds. And it's so much harder for them to let go because at that age, you haven't really got to the concept of my life is going to end one day. And so it's even harder to understand it. Whereas once you've lived 90 years on this planet, you're very familiar with it. You're accepting of it, and it's something you're willing to embrace. But if you don't talk to your family about it, what your wishes are, how you want the last time on earth to be, and who you want to make decisions for you, then it's a free-for-all when it comes time to where you are no longer able to make decisions. Right. And that's the worst time to have somebody questioning, well, what did you want? Yeah. You want people to know what you want.
Especially in a
long
stressful situation.
Exactly.
Where you're not usually making the best decisions.
Exactly. And I always say that is the best gift that you can give your family. Is the conversation of if something terrible were to happen to me, this is what I would want to happen. And I come from, it's a personal standpoint. My husband's mother was hit by a drunk driver when he was 4 years old. And she basically lived the rest of her life in a nursing home, very, very debilitated. And we were able to, towards the end of her life, get her into hospice because she was able to tell us that she didn't want to, to continue to suffer. She was living a life of suffering for quite some time. But with that, my husband was very, very aware of anything could happen to us at any age. Yeah. So it doesn't matter, I mean, when my husband and I got married at 21, we had advanced directives, which is kind of weird, but
wow.
he wanted to know, what do I do, or what would I want you to do, and if that were to happen, because it had happened to him when he was 4, it had happened to his family. Sure. And so you never know what's going to happen, and you want to make sure everybody is on board. And the thing I'm going to say, and this sounds mean, and I'm telling you right now, pick your torturer wisely. And I say that because the person you choose for your advanced directive, that will be the one that makes decisions for you. They will be the ones at the doctor's side helping make every single decision. And so if you have somebody who is not in lockstep with what you want, then it will not happen. And so that's my biggest thing is don't pick, it doesn't matter, you don't have to pick the oldest child, you don't have to pick your husband or your wife, or you pick the person who knows you the most, that will respect your wishes.
And make sure that it's very clear who that person is.
Exactly.
Don't pick more than one person.
Yep, one person.
One person.
Absolutely. Yeah. And a backup in the event that person is not available. Yeah. That's your main thing. But when I filled out my advanced directive, I actually put my husband as the first decision maker and my mom as the second. And nowhere on that piece of paper is my father. And it's not, I love you, Dad. It's not because I don't trust your judgment, but I'm my daddy's little girl.
Sure. Yeah.
And,
he would do everything in the world to save you.
Would do everything, sometimes probably more than what it should be. And I'm not saying my mom doesn't love me either, but there's just, you know. And so pick the people who you want to make your decisions for you. Right. Yeah, absolutely.
And actually, you said parents. I usually think of it being children.
It could be anybody.
Usually, because it's older.
Older people.
I wasn't thinking of somebody as young as you.
Yeah, exactly.
So what is it we can do specifically? What are the forms that we're going to be filling out and talking about?
Yeah, so anybody can go and download a form. If you just type in advanced directive, you can find a million different types of advanced directives. The ones that I like the most are honestly the most explicit. The ones that, well, in this situation, I want this. In this situation, I want, and there's a lot of them available to you. So you can Google them, look through them, and try to identify some that you might like. The other thing you can also do is fill out what's called a physician order for life-sustaining treatment, also known as a POLST. Yes. And that is something that both of your primary care providers can fill out for you. Mm-hmm. It has to be a physician. So it would be, if you have a nurse practitioner, that's fine, but just have the physician sign that. But it will detail your code status, meaning in the event that your heart were to stop beating or you were to stop breathing, would you want people to do chest compressions, shock your heart, and intubate you and put you onto life support machine? You would go through all those decisions, and if you don't want that, then you would mark the box DNR, do not attempt resuscitation. If you wanted everything done and you said, yes, I would want you to attempt resuscitation, you would mark full code. The next step below that is what measures would you want to be taken? If, let's say you said, I want to be DNR, I don't want to be resuscitated. But in the event that I got sick, I could choose full treatment. I could choose limited interventions, and then I could choose comfort care. Comfort care is just do whatever you can do to keep me comfortable. If that means I need fluids because I'm a little bit dehydrated, that's great. If it means pain medications because I'm in pain, that's fine. If it means morphine because I'm short of breath, we can provide that. And then the next section is nutrition, artificial nutrition. Right. Do you want tube feeds, meaning a tube maybe in your nose that would give you nutrition, or do you want a tube that goes into your stomach that would permanently give you food? Some people say that they want a trial of artificial nutrition. Right. And the reason for that is a lot of times people might have a stroke, let's say, and not be able to swallow for a short period of time. I think it's completely reasonable to say, well, let's give it a shot. And then if I can't swallow again, I wouldn't want to have, long-term feeding tubes. So these are all things in the advanced directive and in the physician order for life-sustaining treatment that your physician can help you fill out. And I think the cool thing is, and I'm sure you guys all know this, but maybe your patients don't know, is you could even book an appointment with your doctor just to have this discussion. Right. And there are ways that they can bill for their time so that they are able to dedicate that visit just to that topic.
Right. Yeah, we actually, in people age 65 and over, it's already a part of the script. That
The
we
annual,
Excellent.
the annual wellness
Yeah.
exam.
Not so much
Medicare.
people younger though, and that's something that we need to
Right.
be thinking about is
Yeah.
how much are we going to bring that in, and how are we going to introduce that to patients that's not first and foremost
Yeah.
on things that
on
are
their
going
mind.
in life.
Yeah. And it's like I said, it's maybe when you make decisions based off of experiences, right?
Yep.
And obviously I have a lot of experiences with people dying who never thought they'd be in that situation. And so maybe it shoved that into the forefront of my mind. But I think especially for our patients that have chronic illnesses, if you have diabetes and end stage, kidney disease, but you're only 45, you still need to be thinking about these things because your body is not that of a 45-year-old. Your body is like more of a 65, 70-year-old. And so you're going to have the complications and the risks of having something happen to you that might put you in that situation.
Right.
So, yeah.
Do we have any comments? Of
Plenty.
Plenty.
Some people
questions
talking
for
about
Dr.
some of
Martin?
their experiences that they went through with their family
Yeah.
in hospice, and how that's obviously a difficult time.
It is.
Somebody said that they had brain cancer, and as soon as they got the diagnosis, they filled out their post.
Excellent.
Very good. Glad
Excellent.
you have that.
Yeah.
Be ready.
And Laura Baker comments, you can find your advanced directive forms at your local hospital. Yes,
Yep,
also
absolutely.
another place you can get them if you don't have access to them online.
Absolutely.
Possibly your doctor's office. We
Yes.
have them.
And we have them too. Yeah, ask your doctor about that. Same thing with the pulse form. The pulse form in our office, at least, is this bright pink
Yep,
form.
yep.
And I think it's
It's pretty standard.
universal, right?
standard,
Yeah.
and it's pink.
So,
Yeah.
so that actually the patient takes with them. They have at home, so
Yeah.
so that if the emergency medical services are called, paramedics come to their
Absolutely.
house, they know their wishes. So
Yeah.
that's very important. The Laura with brain cancer is only 58.
Oh,
that's
I'm
so
sorry.
difficult.
Yeah.
And Bianca is going to go look and print one off as soon as I can. Thank you. Your doctor thanks you for that
Yes.
one.
And I see a comment that says from Anastasia, my husband doesn't want to talk about it at all.
So it is a difficult conversation.
Yeah.
So do you have any tips on how to broach that conversation?
It's interesting. It depends. I think it depends on the person because some people just absolutely want to completely avoid it. There's actually, I'm going to say it's interesting. There's a game. There's a game called Go Wish. And it's a card game.
Oh yeah, I know.
Yeah,
I know what you're
and
talking about.
you take the cards and you have a deck, and the loved one that you're playing with has a deck.
Right.
And it lists on the cards all the various things that are important to you, that are important in your life. So it's a way to have the conversation without having the conversation.
Yeah.
And you go through and it'll say, I want to be surrounded by loved ones, or the things that are
ask
important to
questions
you.
about,
And
yeah.
you go through and you line them up. What is important? What's so important, and what's not important at all.
Yeah.
And you will be shocked at some of the things that, and you're supposed to fill it out for what you think the loved one would want, and the loved one is supposed to fill it out for what they want.
Yeah.
And it will be shocking to you to see what you thought was really important to them may not be important at all. And something that you thought wasn't important to them might be the most important thing. So it allows you to have this conversation in, I guess, a dark, fun way, but it's important, and it will uncover a lot. In my own personal experience, I thought for sure that my mother tells me, if anything bad happens to me, just unplug me. I mean, she's adamant, doesn't want. But my dad, I thought he'd be the same. He's a respiratory therapist. He's in the medical field. He had a very different approach. He said, if I can at least just watch some TV and smile and watch my kids do something, then I want to be kept going on. And so I'm glad I had that conversation because I had no idea what his wishes were. So, and he's nowhere near, he's out doing all kinds of things. So it's not, you're not having this conversation because you think the person's going to die.
Right.
You're having the conversation because just in case something happens, you know what you want.
And the sooner the better, because you never know
Exactly.
what the future holds.
Exactly.
Especially if you have somebody who may be headed towards a dementia or
Absolutely.
or some Alzheimer's
Yeah.
type thing, because
Yeah.
there are a lot of things that need to be done as far as care for that individual as they advance
Exactly.
and progress.
Finances, all kinds of things.
Yeah, and
Yeah.
some of those are legal things, but a lot are medical.
Yeah.
You want to think about those.
Yeah.
It's a difficult subject
It
to
is.
approach.
It is.
No matter where you're at, and unfortunately, probably even more so as you get older because you are kind of staring down the barrel, as it were.
Yeah.
But it is one that needs to be had.
Absolutely.
Absolutely. We want you to have the dignity you deserve.
Absolutely.
We just put it that way. And that's always how I approach these things when I have this conversation with my patients. We want to respect your wishes. We want to do what you want and nothing that you don't want.
Exactly.
And we don't want to hurt you in the process of dying if that were to happen.
Yeah, absolutely.
So a lot of it is just how you use the words and what words you use. Go to your doctor. Hopefully you're having your annual wellness exams. This should be, if you are of Medicare age or older and having your annual Medicare exams, this should be something that is discussed at those visits. And your doctor can go into detail and even fill out that pulse form at the visit.
Yep.
Give you the actual advanced directive, which is a much more in-depth, multi-page paper that goes into it. So
exactly.
Yeah, it's difficult, but necessary.
Necessary. Has to happen.
Yeah.
All right.
Absolutely.
Thank you, Vanessa. Any
You're welcome.
final comments from our
Let's see here.
channel members and viewers?
Yeah, Bianca said that her sister died in critical care. So unfortunately, she has some experience with that. Bianca is a channel member. So
Okay.
she gets preferential treatment. And then, some other cancer diagnoses around and what happens. In Canada, we have a living will that is filed at the same time as our regular with our lawyer that spells out our decisions and what you want. Yeah. So this is something that is typically in, if you have like a trust build made for you, it's typically in that too. Like it's usually called a living will when done in that context. But yeah, we have that here in the United States too.
Yeah.
Although for post orders, that needs to be signed by a doctor.
That's by a
Correct.
doctor. And if you do go through your lawyer, I mean, always, if you have questions, we as doctors are always here to answer any of those questions because some of that is kind of more jargon and medical terminology and it can be difficult to understand. Yeah. But we're happy to lay all that out and what that means.
Absolutely.
So.
And if you ever get hospitalized for anything, and it's just even for surgery, any elective surgery, there are social workers and palliative care workers that are happy to come and talk with you at any time and help you fill it out while you're in the hospital, and then they will scan it into your record. That way, it's always there in case you came in an emergency.
Yep. Yeah. And Megan says, love this topic, Dr. Walker. You're getting compliments. And then just so you know, again, the name of the game is Go Wish.
Go Wish.
Yeah,
yep.
We'll put that out
Go
there.
Wish.
Yeah. That's most of the topics.
And one last
Appreciate your comments.
LifeOn10.
LifeOn10.
With Angela Trapp.
Yep. Please check us out. Our next video will be released on February 10th.
That's a week from today.
That's right.
So check out our video. Actually, yours is released at what time?
Well,
first thing in the morning.
It depends on when my husband can get it uploaded. Between the screaming 6-year-old and 3-year-old, it just depends.
Right. Well, we'll be here probably at 4:30, so definitely maybe before that time, if you got a little time, check out their video.
Please do.
Next week
or after.
And right now, you can head on over there and check out their first video, which kind of introduces you to Dr. Walker and Angela.
And the concept of life on
10. Yeah.
Or if you're a Spinal Tap fan, Life on 11. So we certainly want to thank some of our patrons and channel members.
Yes. So over at drgreenknight.com, got a new blog out today, new article. Check it out. I would like to thank my Patreons. That is Boo Boo Kitty and Laura Rott. Thank you. You make it happen.
And I especially want to thank Lindsay Antwine, who has been a part of our channels for many years. Did you have anybody you needed to give thanks to on your?
I'm going to give thanks to my husband, who is doing all the producing, everything. Robert, you're amazing. Keep it up.
Us producers, we appreciate a little bit of
I would like to thank my producer, this guy.
This guy right here.
This guy.
And thank you for allowing me to come on your channel. This is fantastic.
Pleasure. Yeah, we'll have to do this again sometime.
There's so many things that we can talk about.
Yep.
I'd love to keep it up.
You get a few doctors in a row, but they just talk forever.
So with that,
I'm Dr. Gwen Vaughn.
Dr. Vanessa Walker.
And Dr. Mark Vaughn telling you to stay in good health.
We'll see ya.
Bye.